Children's Campaign Fund is proud to recognize Representative Lisa Callan as our 2022 Champion of the Year. This signature annual award is given in recognition of transformative leadership across CCF's issue areas and an unwavering commitment to children, youth, and families. Representative Callan stands out as an incredible advocate and champion for kids across Washington. As co-chair of the Children and Youth Behavioral Health Work Group, Representative Callan has championed for tremendous investment and policy change. She prime-sponsored the biggest behavioral health bills this session, including legislation to advance recommendations from the Children and Youth Behavioral Health Work Group, as well as supporting students with excused absences for mental health reasons.
Even before the pandemic, we knew that our behavioral health care system was stretched far thin. Now, during the pandemic, we've seen it reach a crisis state. When you're a parent that has a child that's not eating, and you're being told that it's going to take months before they can get the care that they need. When you have a child that is too afraid to go to school, and you're being told, sorry, in your county, there are no Medicaid slots available for you. Call back next month. That is a system in crisis. In Washington, we need to do better. I think we can do better.
She also fought for powerful investments for on-site behavioral health for unhoused youth and homeless youth facilities in the capital budget, as well as vital funding for early learning facilities. Please join us in celebrating our 2022 Champion of the Year for her transformative impact and dedication on behalf of children, youth, and families.
Congratulations, Rep. Callan, on being our 2022 Champion of the Year. Just so you all know, we decided very early on that Rep. Callan would be the Champion of the Year this year. It was a unanimous decision with the board. And Jess went out and was reaching out to all of the winners. And when she reached out to Rep. Callan, first thing she said was like, are you sure you're talking about me? Because you were really surprised, which surprised us. But I think that speaks highly of the kind of leader you are. So really excited to celebrate you because it is very well deserved. And you were also nominated for multiple awards in the past year, in 2021 as well, for your leadership on child welfare and other issues across our buckets. So we would like to again say congratulations and ask you the same question that we've been asking all of our champions today. What does being recognized as a champion for kids and families mean to you?
Well, first of all, I'm with Yasmin. These videos are very emotional. It's hard to, when you're listening to testimony or when you're testifying, you can get choked up as well. But it's very humbling, especially being in the room with all of you who have been doing this heart and passion work and doing it because we know that every child in Washington deserves to have their best chance. So it is very humbling, and I'm full of gratitude. And truly, the recognition needs to go to all of my colleagues. I mean, what champions you have brought forward here, and just look at the successes. I was asked by Rep. Kagi earlier, how did it feel to have all the successes in the last session? Sorry, I did get a little bit emotional. And when you see the videos, and then you just see the breadth and depth of what has happened over the last few sessions, it's so exciting for where we're going in Washington State, and all of it is because we have the deep community support and willingness to move the dial to make sure all of our children have what they need, and not just our children, right? It's from perinatal phase and that day one of birth through our children, our youth, and our families, our caregivers, and our systems of care, and our communities, and our schools, and all of those intersection points and where they are. So I'm just deeply gratified to have the depth and breadth of issues that are out there, my colleagues that are here, and the strength of force that we have, and all the work that you all do to make sure that we've got that depth and breadth, and that the issues are out there for the community will to support electing folks to get the work done, you know, and to make sure that we're doing it on every level.
Representative Callan, you know, you're in a tough district. We're also just in really such political divisive times. It can make progress tough, and yet still in this last session, we saw a lot of progress made with behavioral health. Why do you think that is?
Well, I think, you know, for myself, I work hard to make sure that these issues are not partisan. Our children and our families and our community and their well-being is not partisan. That, you know, you saw the little video speech, you know, when you have a child that needs behavioral health services and you can't reach that care, that hits everybody's home. Behavioral health needs physical health, the idea of not having a home to go home to, an area to feel safe, to be able to feel safe in your school. You know, the pandemic certainly touched everybody in, you know, hugely different ways, but it still touched everybody. And I think that when you can tell that narrative and you can connect the dots and show that the issues that we're trying to move forward are really grounding. I mean, it's really about prevention, it's about promotion, it's about early intervention and trying to keep out of the crisis cycle. And everybody gets that because everybody has had somebody in their life that is connected in that way. So it really is necessary for us to make sure that we're bringing those stories home to bear in that way. And I think, you know, some of my colleagues mentioned really bringing forward lived experience and telling the story around the inequities of our system and the racism in our system and so many of these other issues. That's the stories that we're telling because they're real, and those are real impacts. And it's our job to make sure that that is coming out.
I really appreciated, first of all, I appreciate you saying, you know, it's important to center those stories. I've really appreciated seeing you work directly with those communities to help shape some of the policies that you have helped pass, specifically with young people. And I think a lot of my work is with young people, and it's very rare for them to speak highly of legislators, and genuinely with the young people I've come across, they've spoken very highly of you. And I think that says, again, a lot about the kind of leader you are. But yeah, I've really appreciated that. So you are the champion of the year, not just because of your leadership on game-changing behavioral health bills, but also because you delivered policy impacts across CCF's issue areas. Why is it important to you to look at the whole picture in a whole child, whole family, within a whole community way as you navigate competing priorities to deliver policy impacts for kids?
You don't have to spend much time talking to me to know that I'm a very big systems thinker. I definitely bring some of my engineering brain to work in this space, along with my heart and passion, in that everything is connected, the intersectionality of all of the issues, whether it's through our systems, again, our schools, our communities, people's ability to thrive, the money that they have in their pocket, you know, to be able to spend on their basic needs and services, you know, everything. That's one thing I learned, at least being in a school board. I used to, when I ran for the state legislature, talked about my experience on the school board, and little folks notice, they think you're only going to talk about reading, writing, math, arithmetic, you know, maybe recess, maybe the length of lunch, time and that type of stuff. But you cover, you know, property taxes, you're covering transportation issues, you're covering quality of water, you know, public safety and health issues. There's not anything that isn't connected to a person's ability to thrive. So unless you're really, I mean, to talk on a single issue and not make sure that you're understanding how all of that impacts every other aspect of the health and well-being of not only the individual as an adult, as a child, but you have to understand what the impact is on the community. You have to understand where the community is coming from. You have to have that deep listening. You have to understand how the systems aren't showing up to these communities. Again, that goes right back into our equity work, right? And really peeling back that onion. I know in my school district where I was a school board member, we had great graduation rates, but as soon as you started to disaggregate the data, you recognized that our students of color were not succeeding. So, yay, go, great school district. No, not for everybody. So you really have to understand and make sure that you're doing all of those connections. It really is the whole child. It really is the whole community and the family. Make sure that we're solving problems that are not single issue problems. Otherwise they would have been solved already. They're complex, they're multi-layered, and we're all in for the fight. There's no one here that isn't on this Zoom box that I'm seeing that hasn't been, way down in the dirt trying to figure out how to solve these.